Sarve Bhavantu Sukhine. Welcome to this episode of Ask Dr Gupta. When someone is on treatment for cancer with chemotherapy, the infection fighting white blood cells in our blood get reduced. This leads to temporary reduction in infection fighting capacity of the body. Since food can be a potential source of infections, so some precautions are necessary in diet while the patient is on chemotherapy. However, dietary restrictions in any illness for that matter, not only cancer but any illness. This is something in which every relative and every neighbor seems to be specialized in. They claim to be an expert in telling dietary restrictions for any disease, any illness. Nobody among these self-proclaimed experts is bothered about the maintenance of nutritional status of the patient, it seems. Everyone is obsessed with dietary restrictions only. A lot of confusion prevails among doctors also, especially those doctors who are not oncologists. Today we shall try to discuss what all can be taken and what all should be taken by anybody undergoing chemotherapy treatment for cancer. We shall discuss the items to be avoided and shall also discuss what all we can eat to help us tolerate chemotherapy treatment better. Before we discuss what to eat, we better talk about how to eat. Do remember to wash your hands with soap and water before every meal. Also remember to rinse your mouth with water after whatever you eat. Chemotherapy can give rise to nausea and also to vomiting. So it is better if food is taken as small meals at shorter intervals. Cooking and boiling, as we all know, kills most of the bacteria in the food. It is therefore logical that freshly cooked food will be safer than uncooked. Among the freshly cooked, almost everything can be eaten provided it is made at home. We all regularly see the videos of unhygienic cooking practices in different eateries, so it is safe to stick to home cooked food while the person is on chemotherapy treatment. Packed food from outside like biscuits are relatively safe and they can be safely consumed. This blanket statement about cooked food is sometimes interpreted to mean that nothing raw can be taken. The patients are sometimes prohibited completely from eating all kinds of salads and fruits. I will say this is a bit extreme. The fruits that have thick skin that can be completely separated are generally safe. Like bananas, oranges, and even cucumber and melons can be safely consumed provided they are freshly cut and are consumed immediately. In fact, complete stoppage of all fruits and vegetables will lead to disturbances in the gut bacterial flora, and it also has the potential of causing deficiency of micronutrients and deficiency of fiber. This information about raw items might come as relief to those people, those relatives who are fond of carrying fruits while going to see any patient. After fruits, the next most common query is about juices. Fruit juices are of course tasty, in addition to being rich in nutrition also. However, many cancer patients are diabetic also, and juices can jeopardize their glycemic control, and disturbed glycemic control will further increase their infection risk. One more problem faced by juice consumption in many patients is the feeling of being fed up after taking juice. This jeopardizes their main diet. So juice should be taken only in moderation and not as a replacement of food. Juice can be a big source of infection if the barrier of hygiene gets broken. It is safe to make juices at home for those on chemotherapy. Otherwise, packed juices are also safe. The juice from roadside thelas is very unsafe. Avoid it. One question very commonly asked during chemotherapy is about consumption of milk and relation of milk with infections. People feel milk can increase infection. This is under the mistaken belief that milk is white and consumption of milk will lead to increase in pus formation because pus is also white. This belief emerges from complete ignorance about nutrition and about infection. By this yardstick, watermelon consumption should lead to increase in hemoglobin. That we know does not happen. Boiled milk and milk products can be safely consumed provided the precautions about freshness are observed. Junk food is best avoided during chemotherapy. The chemotherapy drugs, as we just said, can cause nausea, and junk food is heavy. Heavy items can create problems in digestion and they can give rise to vomiting also. We all know that water is responsible for most of the foodborne epidemics. It retains its importance in chemotherapy treatment also. Patients on chemotherapy need good amount of water to maintain their hydration and also to enable their kidneys to flush the waste of chemotherapy and the waste of tumor destruction. Water should either be filtered or it should be boiled. A purifier installed at your home may not ensure safety unless its filters are regularly changed. Reverse osmosis, popularly known as RO, has more to do with the control of salts and control of taste of water than its purity. If there are any doubts about the purity of water that is being consumed, that it is safe to boil water before consumption. The bottled water of various brands available in market can be spurious and it is best avoided. Chemotherapy, just like antibiotics, can jeopardize your intestinal bacterial flora. It will be good if homemade probiotics like yogurt, like dhokla and idli are included in diet, but homemade. Many patients tend to gain weight after completion of their chemotherapy. This generally happens because of rebound increase in appetite once the chemotherapy treatment is complete. This should be taken care of specifically, and exercise should be part of daily routine after completion of treatment. What we discover is that judicious consumption of a balanced diet, not extreme restrictions, is the key to maintenance of nutritional status during chemotherapy. Do not settle for only boiled vegetables during treatment. Ask your oncologist and don't let the treatment of chemotherapy and its entire duration become an ordeal for cancer patient. With all this, I wish all cancer patients a speedy recovery and everybody a healthy life. Namaskar.